epidemiological value of closing them. But, of course, looking at the way people behave, at the way they are responding, we keep that under constant review. And if people can't make use of parks and playgrounds responsibly, and you make a very good point about kids, but if they can't do it in a way that observes the 2-metre rule, then of course we're going to have to look at further measures. And the general principle should be that we should all, as far as we possibly can, stay home, protect our NHS, and thereby save lives.
So responding to your comments about the number of deaths, I mean, obviously any death is a sad event, and it's really difficult for us to, I think, contemplate the fact that we will have many more in this country, just as we have seen in other countries. We are expecting that. The actions today particularly are focused precisely on avoiding those additional deaths. That is the main purpose of the shielding task, not the reduction in numbers, but the reduction in deaths. So I think it makes it even more important that we're taking this action. But I think there is a general comment, which I've alluded to before, in expectation about numbers, because when you start counting deaths and the percentage, I've just done a very quick sum while I was doing this about what our current position is, and I think if you calculated Italy's case fatality rate now is about 10% and ours is 4%. Actually, we think overall, and we still think, that it should be about 1%. And what both of these numbers demonstrate is that the numbers that you get change throughout the course of an epidemic, and it changes very much on how you count the cases as well. So as you go through a very sharp rise in numbers, which we will see going forward, you have to be careful not to be comparing too precisely, because at the moment in this country we are counting the most significant disease, and it would look as if our case rates, our death rates are actually increasing. We know that is what will happen. So it's really just a reminder to say we will look back in due course, sadly, and see the true number of people who have died from coronavirus. But a direct comparison with another country and against individual numbers is something that we should be very cautious of as we go through the epidemic.
Thanks, Jenny. Jess Savage, ITV. Jess.
Hello, thank you very much. Thank you. In speaking about social distancing and the 2-metre rule that you've spoken about, it's very obvious from a lot of the images that we're seeing across this weekend that a lot of people are not adhering to that. And you've spoken about further measures potentially being introduced. Could you explain to us what you think those further measures might be and when you would consider implementing them? And also, ITV News has heard from one doctor who says that her hospital is already running out of ventilators, and that people as young as in their 30s and 40s are waiting to get into intensive care, and that she fears they may, in fact, die before they're treated. So do you believe there are enough ventilators, and how fast are hospitals going to get more?
Well, first of all, Jess, on ventilators, we have, we think, a good supply at the moment, but we need to get far more. You're absolutely right, and that's why there's a huge national effort to equip ourselves not just with ventilators, but with all the testing kits, the reagents, all the stuff that we're going to need to beat this disease, and we will. But I'll ask Jenny to say a bit more about the particular hospital that you mentioned and the threat there, because I'm not aware of that particular issue. On social distancing and the further measures that we may bring in, well, I don't think you need to use your imagination very much to see where we might have to go, and we will think about this very actively in the next 24 hours. We need to think about the kinds of measures that we've seen elsewhere, other countries that have been forced to bring in restrictions on people's movements altogether. Now, as I say, I don't want to do that, because I've tried to explain the public health benefits, the benefits to people's mental and physical well-being in the sense that you can go out. And it's so important that that pleasure and that ability is preserved. But it can only really be preserved if everybody acts responsibly. and conforms with those principles of staying apart from one another and social distancing. I know it's hard, but that's the best way forward. If we can't do that, then I'm afraid we're going to have to bring forward tougher measures. But Jenny, do you want to say something particularly about the ventilators?
I wasn't actually going to refer specifically to a hospital, but I think just to say, so I think we're all very aware that London currently and a few other places are starting to see very significant rises. We knew this would happen. This is it's not what we want to happen, but we know that will happen. So the flexing of the system is designed to manage some of these bumps, if you like, where we get a high throughput of patients requiring ventilation. I mean, we monitor beds all the time. The data I have here says that in England, only 12% of adult critical care beds are currently occupied with COVID patients. That will change drastically as we go through the epidemic. But I'm also aware that all hospitals have been asked to step up their training. So on a personal basis, I have a junior doctor in my family. I know she was doing ventilator training on Friday. So there are a number of approaches to which, if we're looking at what we might say was a standard ventilator bed, what we, if you were in a hospital, you would see routinely as that is the capacity. There are flex plans sitting behind that to boost them using additional support. So I think we are not in a position where the country at the moment does not have sufficient ventilator capacity.
Thank you. They were working very hard to get it. I mean, to massively to increase it. Be in no doubt about that. Chris Smith, The Times.
Thank you. Firstly, to Dr. Harris, on the shielding plans, how confident can we be that the NHS is going to identify the right people, given NHS England has already acknowledged that GPs' databases are not sophisticated enough to do this? Are people going to fall through the net or be worried unnecessarily? And also, what thought has been given the demands you're placing on people isolating themselves for an open-ended period of time, that the mental health toll of this is not itself going to be quite dangerous for them? And to the Prime Minister, you said we're 2 weeks behind Italy. 2 weeks ago tomorrow, Italy imposed a lockdown. You've hinted today that you are thinking of that, but given where we are in the epidemic, if not now, then when?
Let me just say on again, I'm just taking Jenny's earlier points about the difficulties of comparison between countries. But what we are trying to do is to push down on that growth curve and to get our NHS ready. What we don't know is the effect that the measures we have already taken. We don't know at this stage whether the measures we took 10 days ago, a week ago, and so on, whether they're starting to have an effect. And that's the thing that's incalculable at the moment, but we can't obviously take any risks with that. And when you say, if not now, when is the moment? The answer is always to be guided by the science. And there's a point that I think people intuitively understand about the timing of these measures. You've got to impose these interventions in the spread of the epidemic at the moment when they can have the maximum effect. And after all, when the epidemic is hardly spreading at all, that's not the moment to impose curfews and prohibitions on movement and so on and so forth. You've got to wait until, until it's the right moment to do it. And that's always been how we've been guided. So, for instance, in the measure that we're announcing today on shielding, I think I made it clear right at the beginning, if you were there at the beginning, that we wouldn't bring in shielding until which is the moment of maximum protection, and as you rightly say, psychologically quite taxing for elderly people. We wouldn't bring that moment in until it coincided with their moment of maximum exposure to the disease. So you try and make the two things coincide, and we will do absolutely everything in accordance with the advice that we get from SAGE, from the CMO, from the CSA, about when our measures can have the maximum impact in stopping the spread of the disease. But basically what people need to understand today is that their best bet to stop the spread of the disease, protect our NHS, save lives, is stay at home if you possibly can. Stay at home if you possibly can.
So I'll work in reverse, if that's right. So I think you mentioned the mental health issues, which are absolutely recognised, as the Prime Minister said. If we're asking people to stay away broadly from others for 12 weeks, that's quite a large ask of people. It is obviously for their own protection, and many of them will be able to self-identify, but I'll come back to that. For mental health, the letter that they will receive will direct them to Every Mind Matters and to the NHS Mental Health and Wellbeing websites. Now, we recognise that a number of people, these are people of all ages, obviously people perhaps if they're older will not be as familiar with that, and that's exactly the purpose of the hubs, to ensure that there is a safety net behind, so that if somebody has psychological needs as well as general daily living needs or a clinical need, they have a support system. And I suspect what is likely to happen is communities, local authorities know their communities really well. They know where their vulnerable individuals are for whatever it be, whether it be a clinical need or a social one. And they will be able to, they'll make that connection and the individual will be able to support. Some will need very little support at all. They'll have families who can help them. But clearly it's the most vulnerable that we need to. So that is very well recognised. It's written within the guidance and it will come through the hubs. On the issue of identification, you are right, it is a hugely complex task. These diseases are not common. They are 1.5 million sounds a large number, but it's actually a very small proportion of the population. And they are spread across a number of different clinical specialties. So we have approached it by 3 or 4 different routes. So the first one is, as I said, through a digital route, but we absolutely recognise that that will not pick up, for example, every individual with a condition who is having a particular sort of immunosuppressive treatment that is being provided maybe not by their GP but by a hospital specialist. So we've gone down 4 different routes, one through that digital element, one through the clinical reference groups who do much of the specialised health service commissioning work, one through the trusts and the medical royal colleges, and then finally there is a kind of catch-all at the end of it, which is in a couple of weeks, if you have not had contact that way, then you can always raise it with your GP yourself. We're not keen for people to do that initially. We're pretty sure we will get most of those people, or they will identify themselves. And clearly those GPs are working really hard on the front line at the moment. So there is a catch-all at the end of it, and a general practitioner is perfectly entitled to raise the issue for any of his patients, his or her patients that they think are in that category. So hopefully we will catch everybody. I would also just like to say, of course, that this is not a treatment that we're trying to give them. What we're actually saying is, do what we've asked you to do, all of the things we've said, but just do them very tightly. So in the interim phase, if they just follow the social distancing policy tightly, that's effectively what we're asking them to do.
Thanks, Jenny. Larissa Brown, Daily Mail.
Thank you. Prime Minister, people aren't acting responsibly, so when are you going to get tougher and bring in the police? And Mr.
Bring in the police?
Yes.
Right.
You've talked about curfews, so could you talk about what the police could do and when? And Mr. Jenrick, people that aren't on the list, if they're still worried, can they contact and make use of these community hubs? And Dr. Harris, can you talk a bit about the dangers of being outside and if you can contract the virus whilst you're walking outside? And should over 70s be going on sort of strolls in the evening, or should they be staying at home? Thank you.
Thanks. Well, Larissa, I really repeat the answer I've given. I say as firmly, as strongly as I can to everybody that in going outside now, in taking exercise and enjoying themselves, enjoying yourselves out of doors, you've got to take account of the medical advice. You've got to observe social distancing. And Larissa, yes, you're absolutely right. And I've said it several times now this afternoon. If people can't do that, won't do that, don't do that, then yes, of course, we're going to have to bring in tougher measures. We don't want to do that, of course we don't, but that may well be necessary.
Well, if I may answer your question as well, of course, as you heard from Jenny earlier, no system is full safe. There may be some individuals who have not been caught by the various processes that we've been through, although of course we hope that isn't the case. If there are people who feel that they fall into that category, they can contact their GP or they can contact their local hub once that's established. But for all the reasons that Jenny set out, we don't encourage people to do that today because we don't want to put an unnecessary burden on GP surgeries and their phone lines. There's also another group of people who are otherwise vulnerable, who will be self-isolating or staying at home in the weeks and months ahead. And those individuals may not be on these lists because they may not have a specific clinical reason to be concerned and fall within the shielding initiative that we're launching today. But nonetheless, they may be vulnerable, they may need support, they may need their medicines and food brought to them. And for them, the hubs will absolutely be there to support them, as will all sorts of other volunteering efforts that we're encouraging as a government and which are already taking off in most parts of the country.
Thanks, Robert. Last question from... Oh, sorry.
So I think you asked a question about 70s and over and going outside. So number one, if the 70 and over are in the shielded group, they should not. We're saying very strongly there, stay at home. This is very much an enclosed group, which is why it's such a big thing to ask people to do. If you are 70 and over and are therefore more vulnerable because of your age or perhaps an underlying condition with your age, we are encouraging you to stay at home. We are asking everybody, but this group particularly, to cut right down on their social contacts. The principle running along this and the principle of staying at home is reduce the number of social contacts that you have. So that applies to this group as well. And we're asking people in the general vulnerable group, the elderly people included in that, to do that. However, as we've heard with a number of these other areas, there is a real balance point here. What we do not want to find is that we grow mental health problems or we grow other physical problems because of such a strict imposition, which is exactly the point that the Prime Minister's making. So I think the real point here, as we keep discussing, but just to put the science behind it, the virus doesn't last well outside for all sorts of reasons around temperature, UV light and everything else. So actually an outdoor environment compared with an indoor one is generally a safer one. But the difficulty is if people are congregating outside or coming together. So a reasonably fit 70-year-old who has been cooped up because he's safely isolating in a home for a number of times and wants to go out for a bit of fresh air and does so at a distance of 2 metres from somebody else, will no doubt boost his mental health, and he'll feel able then to tuck himself away perhaps for the next 23 and a half hours quite safely and reduce the total number of his social contacts. So it is the principles underlying this which are really important, and I think it's those ones that we should be trying to get out to the public and through that encouraging people who currently are congregating. They are dangerous. They are making the outside environment unavailable to others who need it. And it's those individuals that we would ask not to congregate outside and to ensure that everybody can have just a little bit of safe space when they need it.
Thank you. That's very, very clear. Charles Hymers, Telegraph.
One question to you, Prime Minister, is the issue of gatherings. And what size is a gathering that you should restrict and ban, and particularly as regarding private gatherings where you might have a group of students who've got together for a party? How are you going to deal with that? Are you going to make that illegal? And then, Mr. Jenrick, just a very simple, straightforward question on the packages. Is the food going to be free? And how will they actually order it? Just the precise details of how that process works.
Charles, on the technicalities of the size of gatherings, if you don't mind, I'm going to ask Jenny to answer.
So I think, as we've said in a number of these briefings before, actually the very large gatherings, you are still surrounded by a smallish group of individuals, and it is that proximity which is the problem. But it is the social gathering as well, usually with a large one, most before and after. So it was the pub, the restaurant,